Please have our cameras on. We would be live for the next few minutes. Seconds rather. We're live now. Good morning, bonjour, guten tag, and namaskar to our distinguished chief guest, Professor Dr. P.K. Rajput sir, esteemed guest speakers, and other attendees who've tuned in from around the globe. It is indeed an honor and a privilege to be hosting such talented and learned stalwarts on this splendid platform of IIU. I would like to extend a very warm welcome to all our distinguished guests to day 2 of the second International Conference on Traditional, Complementary and Alternative Medicine 2024. But before we set the ball rolling for this evening, let me start by first and foremost appreciating the very platform of International Internship University, which is the center stage for tonight's deliberation. The IIU is a leading global educational institution focused on delivering practical, skills-based learning through internships. Our mission is to bridge the gap between traditional academic education and the real-world job market, providing students with hands-on experience in their chosen fields. To our advanced virtual platform, IIU connects over 1,000 voluntary educators, professors, leaders, and experts from across the globe. We offer a diverse range of courses designed to meet the demands of modern careers, including cutting-edge programs in AI, robotics, blockchain, and more. IIU is registered in New South Wales, Australia, under the Trust Act in India, and holds international registrations in the US and Nepal. We are accredited by the World Education Organization, WEO, an ISO certified learning body and a patented learning provider. Our educational model aligns with international standards and is built on deep research and high-quality content, developed by qualified experts from various countries. In addition to our virtual platform, IIU offers a physical campus in India for internship programs. Here, students can engage in fields such as law, social sciences, rural development, tourism, NGO sectors, entrepreneurship, and SDG-based internships. Excuse me. These include eco-friendly farming, water harvesting, solar energy, clean air initiatives, healthcare, and rural development. Students can also participate in our residential internship program, which provides immersive learning experiences. As we work towards becoming the world's first UGC-approved virtual internship-based university, IIU remains committed to providing high-quality, accessible, and flexible education to students globally, including those in remote areas. Our focus on 21st century skills ensures that students are well prepared to build successful careers in the industries of the future. Without further ado, let's start with setting the tone for this dialogue. May I now present to you the very first speaker, Senior Vice President, Kerala Pharma, Global Speaker, International Life Coach, Mentor, Change Maker, Author, and Advisory Board Member of various institutions. It is indeed a great honor and privilege to invite on this stage respected Professor Dr. P.K. Rajput, sir. A very warm welcome to you, sir, and good afternoon to you, sir.
Thank you so much. Very, very good afternoon to you, madam, and all the wonderful, eminent personalities who have joined from the different part of the world. It is always a pleasure to be a part of IIU, coming here to the IIU and talking about the things which is very important. I'm so happy that today we are talking on the very second day, which is very, very important. And then we are developing so many things under the IIU guidelines, which is the real need of the hour. Today is the second day where we are talking about the pharmaceutical industry, which is there. So I like to give a brief profile on the entire scenario of the Indian pharmaceutical industry. I know many of the people are aware about it, and at the same time, only for the sake of repetition, and also by 2047, what we are going to plan as a Indian, as a Bharati, or the Constitution, I like to highlight it here. So, with my respect to all the attendees, all the speakers, all the wonderful personalities, all the learned members, and I welcome them on the IIU platform. So, let me tell you, the Indian pharma industry is the third largest producer of by volume and 14th largest by value. That is the beauty of Indian pharma industry. Why I'm saying so about it? Because myself, I have worked for 40 years with the Cadila Pharmaceuticals. I was the senior vice president, sales and marketing for entire India and 25 countries. And we have launched multiple brands. We have come with new products also. We are able to see that how the brands are making a difference, because health is a wealth, and building the health of every person, it is very important today in this scenario, when nobody wants to waste their time. They simply want to pop up the pill, and then they want to go for the work. That's why the industry is ruling the things, and they are providing the medicines which is very much required, and the safer medicines which are required. The Indian pharmaceutical industry is projected to reach by 65 billion by end of few months, by because that was a prediction of 2024. But at the same time, by 2030, this Indian pharmaceutical industry will be reaching 130 billion. How? Because there is a growth of 12% on the CAGR basis. That is the strength of pharmaceutical industry. The pharmaceutical industry and healthcare sectors are on the brink of transformative era, right? Promising a brighter future where many people, many professionals, many big pharma, many doctors, many healthcare will be getting their job services to help the humankind, which is very important. Today, India stands as a crucial juncture as we approach our 100th year of independence in 2047. And that's why we say that it will be going to become a Vishwaguru, which is important. The vision is to transition from being the pharmacy of the world, because today India is known as pharmacy of the world, but the vision is to become the pharma powerhouse for the world, which has been encapsulated in the motto of our Viksit Bharat at the rate 2047. Because by 2047, by enjoying 100 years, we will be there in that particular segment, and we will be known as pharma powerhouse for the world. Dear listeners, dear friends, dear brothers and sisters, India's healthcare system is self reliant and interconnected with global advancement and innovation. The journey ahead is marked by Amrit Kal, symbolizing an era that demands resilience, responsibility, and the foresight. Aligning with India's aspirations to be a developed nation, we all are focusing on value driven research and high impact innovation, seamless global pharma supply chain, sustainable and equitable access to the healthcare. When I say about seamless global pharma supply chain, in India, we see that the medicine should reach to the last person in the country. Same way, by 2047, the medicine which will be produced or which will be delivered, it should be reaching the to all 200 countries, which is very important. It is also essential to create an ecosystem prioritizing the patient's outcome. The healthcare providers, the pharma companies, policymakers, and the payers, they all collaborate effectively. We as a Bharatiya, we as an Indian, we envision an India where healthcare is innovative, accessible, and equitable for all. Now, let me talk about the future opportunities and the challenges, because whenever there are good things are happening, there are more opportunities are there, and at the same time, their challenges are also there. but challenges has to be converted to the opportunity, which is very important. India has the largest talent pool with a significant number of pharmacy graduates. However, there is a small disconnect between their skills and industry needs. And that is why, we keep on talking about industry academia collaboration. And that was the reason when I took the farewell from the company, I said, let me build the pharmacy graduate, the young minds, so that it can be bridged up very well. So initiatives are needed. Initiatives are really needed to ensure these graduates are well equipped for upcoming role within the industry. And at the same time, we all agree that digital technology is coming very well. We all are working, the things are getting changed, right? And every time new things are coming. Now Gemini 2.0 is also come, you know that, right? And apart from so many things. So when there is a change is happening and artificial intelligence and so many good things are there, the digital technology is going to be have a crucial role for transforming healthcare sector, enabling the collection and the analysis of the vast data, not the waste data, vast data, to improve decision making and outcomes. That is the reason the algorithms have been prepared. And artificial intelligence, it works on the algorithms, which is the real things. AI and ML algorithms are enhancing the clinical decision making and personalized treatment. Today we talk about the precision medicine. So the precision treatment will be there for the people which are really required. Advancement in the medical technology, which includes the wearable devices, telehealth, are making healthcare more accessible and patient centric. When I talk about the telehealth, a person sitting in the remotest of the remotest area, he or she, they can take the best of the medicine treatment from the more qualified doctors, which is a beauty of the telehealth. I will also like to add here that the collaboration with the tech startup which we are talking, it is going to help pharma company in a bigger way, because the pharmaceutical company or the pharma people should collaborate with the tech startups and medical device companies to offer a user-friendly point of care diagnostic, remote monitoring solutions, mobile health apps and self-care programs, and disease management platform. These are the basic things are there which is really required, and people or the companies, they are working, and doctors, the healthcare providers, they are helping to make it happen. Towards a connected healthcare model, how it can happen. So globally, digital health technology is redefining the care delivery, centering the patient in a connected healthcare ecosystem. While doing this, while embracing these digital health components, Bharat or India can establish a patient-centric approach and a complete healthcare system that adapts to the future challenges, contributing to a truly Viksit Bharat. And this can be taken care by the non-developed country, by the developing country, and once we are going to be a complete developed country. At the same time, innovative financing models can encourage the healthier behaviors and reducing the long-term healthcare cost. By implementing diverse financial strategy, we India can provide the comprehensive health coverage, ensuring no one is left behind in pursuit of healthcare future. There are a lot many schemes are there in India where we are able to support. Today, recently, just a month back, our respected Prime Minister has launched a new scheme, and he is providing the health care up to the age of 70 and above, a 5 lakh rupees benefit. So these are the good things are happening there, so that any person who is an elderly person can be treated very well in best of the best hospital. So today I can once again convey my sincere gratitude that today again IIU has made significant strides in recognizing the industry leaders talking about the medicine healthcare system, and we're making the impactful changes and supporting the vision of Viksit Bharat. Once again, Anju Madam and IIU, under the great leadership of uh, Advocate Piyush Pandit sir and all the incredible people, we thank you for your seamless commitment to transforming the future of healthcare in India through the education, through the various ways, and promoting it on your incredible platform of ICC, where the great people, where all the learned people are coming here, they are giving their insight that how it can be built. And it is a great initiative which has been taken. And I wish again a great success. And at the last, I feel myself very happy, blessed to be a part of IIU in such type of great platform. Thank you, Dr. Latif Sahab. Thank you, Anju ma'am. Thank you, everybody who is listening. And again, it's an honor, an honor. Thank you. Shukriya.
Thank you so much, sir. Always the same energy, the same inspiration. I think you have definitely set the ball rolling for today's deliberations. Thank you so much, sir, for your presence tonight and for making the wonderful start that we needed today. Thank you so much, sir. It's always a pleasure to have you on board.
Thank you, ma'am. My honor.
Right. Moving on, I would now like to request Dr. Zishan. Dr. Zishan, are you there to take up the next segment, or is it Dr. Rex to take up the next segment
Yes, ma'am.
speakers?
Yes, ma'am. I'm here.
Yeah.
Thank
So,
you so
Dr.
much for inviting me.
Yeah. So, Dr. Zishan, could you take up the next segment of speakers and continue with the conference, sir?
Sure, ma'am. Sure.
Yeah.
I
Thank
will.
you so much.
Thank you so much for inviting me. And Dr. P.K. Rajput for such a grateful insight. Or are managing our overview the whole uh, purpose of the conference, which are uh, which are held in 2024. So, before we proceed, I would like to take a moment to express our gratitude to the distinguished speaker from the day first, who presented such an insightful discussion and valuable perspectives yesterday. Their contribution laid a strong foundation for understanding the potential of traditional and alternative medicine in modern healthcare system. This conference is a platform to explore and promote alternative health, healing methodologies, holistic wellness approaches, and integrate traditional medical system into modern healthcare frameworks. So, first of all, I would like to sincerely thank to all our participants from around the world who joined us today, uh, are joining yesterday, and support us. Your active engagement, thoughtful questions, and enthusiasm are what make this conference truly impactful. So, before we begin, I would like to take a moment to introduce myself. My name is Zishan Ahmed, and I have been a proud member of the IIU Medical Council since the start of 2024. It is an honor for me to serve as as the moderator for the second day of this prestigious conference. My roles involve facilitating today's session, ensuring a smooth flow of discussion, and engaging with our distinguished speakers and participants to create a collaborative and insightful environment. Being a part of the IIU, I have had the opportunity to contribute to promoting traditional and alternative medicine, which align with our shared mission to integrate innovative approaches into modern healthcare. So, today we are honored to have some distinguished speakers, each of whom brings unique expertise in the field of complementary and alternative medicine. Uh, Now, I would like to request you to introduce our esteemed speaker for day two, Dr. Latifullah Khattak, Ariba Munir, Salini Das, Anita Lee, and Dr. Bumara Peace Chichipulam. So, we will gain insightful from their research, experience, and innovative solutions that are driving advancement in traditional and complementary medicine globally. So, together we uh, more integrated health care system. Uh, Thank you for joining us, and I look forward to an engaging session. So, I would like to invite Mr. Dr. Latifullah Khattak to uh, to deliver such an insightful uh, his research. Dr. Latifullah Khattak, are you there?
Yes. Good afternoon. Assalamu alaikum. Namaste. How are you all? thank you for inviting me for such a wonderful platform with wonderful peoples. And special thank to Professor Dr. P.K. Rajput and IIU management. Should I share my presentation as?
Yes. Yes,
Okay.
sir. If you can share, it's perfect. Otherwise, I can assist you. Either way. आप करेंगे शेयर सर या मैं कर दूं आपके लिए?
जी मैं कर रहा हूं.
ठीक है सर. ठीक है सर.
My screen is visible now.
Yes, sir.
Yes,
Okay.
yes.
Okay, thank you. So, good afternoon to all of the prestigious IIU participants and faculty members and professors and students and all the other listeners across the globe. It's very wonderful and very remarkable day for me as well to be among skillful and brilliant people like you all. So there is a topic, a potential role of ashwagandha in reducing the stress and enhancing sleep quality. This was a research randomized control trial done by me and my co-researcher, Ms. Sumaya. So I got the opportunity to present my this research in front of you all. So being in the era of 2024, after post-COVID-19, there is a very great increase in the mental health disorders across the globe, with 300 million people suffering from depression, and 1 out of 4 people among all over the population is suffering from one sort of mental disease or some but other. And there is a very remarkable increase in mental stress and disorders throughout the planet. Looking into this, the WHO and UN also taking measures as accountable from Sustainable Development Goals by 2030. They are also taking more actions to control the mental health disorders. So within this connection, the potential role of ashwagandha, a herb, we tried this herb as a nutraceutical on some patients as controlled randomized trial. Uh, with my presentation, I am Dr. Latifullah Khatak. I did my Doctor of Medicine from Central America, and I am Fellow Royal Society for Public Health. And I did my Master of Science in Public Health from Peshawar and my Master of Science in Nutrition Sciences from Islamabad. I'm associated with Lahore University of Management Sciences as with Diploma in Health Profession Education. And currently I'm leading the Research and Development Wing of Calorie Hacker Pakistan, a non-for-profit organization which is working in healthcare and educational research and development. So ashwagandha, teammate was Sumera Imran. She is currently serving at Kingdom of Saudi Arabia. She did her Master of Public Nutrition from Islamabad, and she is MPhil graduate from Noor International University, Lahore. So the abstract of my research was the chronic stress and poor sleep quality affect overall health of the individuals. So ashwagandha's adaptogenic properties are gaining attention in alternative medicines. So this was a randomized control trial. We took 120 participants and we made 2 groups of the participant with 60 is control group and 60 is the other one. So we applied for the non-control group as 300 milligram ashwagandha daily versus placebo group for 12 weeks. And the outcomes we took as stress, deep quality cortisol levels, and well-beings. So ashwagandha is an ancient Indian herb. So everybody, as we all are related to alternative medicine, complementary medicine, traditional medicine, it's Indian ginseng or winter cherry. It's a shrub-like plant belonging to the Solanaceae family, native to the Indian subcontinent, Africa, and the Middle East. So this is some sort of literature review. As an ancient herb used, it has been traced back some 3,000 to 4,000 years back. The use of ashwagandha was in practice in the societies. So ashwagandha supplementation reduces cortisol levels and improves stress tolerance in individual. with chronic stress. So ashwagandha extract exhibited anti-inflammatory, reducing inflammation and improving symptoms in patients with rheumatoid arthritis. Due to its anti-arthritic activities, it is great role in the arthritis and inflammation activities. So its supplementation improved cognitive function and reduced symptoms of anxiety and depression in individuals with chronic stress. Its supplementation improved exercise performance, increasing muscle strength and reducing muscle damage and inflammation. So the objective was to rule out the ashwagandha, whether it has some role of in reducing the stress and enhancing sleep quality or not. This was the main objective of our research. So the participants were uh, checked back with some four types of things were moderate to severe stress and sleep disturbances. The intervention group one was with given 300 milligram ashwagandha extract daily as a single dose, and group two was given with placebo. The duration of the procedure, the process research was 12 weeks. In this, we made the PSS, PSQ, cerebral cortisol, and well-being questionnaire. So this was the record-keeping tools, research tools, which we applied during the research. So after analysis, the results were very astonishing. The stress reduction was noted. PSS score was significantly reduced in the ashwagandha group, while the other was not. And salivary cortisol level dropped by 23% in the group one, which were given ashwagandha as 300 milligram per day. And it indicated reduced physiological stress as we took data from the questionnaire. The sleep quality improvement was PSQ I scores improved in the ashwagandha groups as compared to the other group. Participants reported better sleep duration and quality who were using ashwagandha 300 milligram per day. So the enhanced level of energy and mood stability was also recorded there. So the ashwagandha shows promises as natural stress reliever, safe, effective, and without any adverse effect in these patients. Possible mechanism was adaptogenic action, and cortisol regulation was the main cause. Still, after we got these type of recorded and research data, we still think that there is future research gaps which could be done in to get more insight into these things. So ashwagandha improves stress and sleep quality and stress results. Integrating ashwagandha into holistic health strategies could benefit mental and physical well-being. So future research should explore broader applications. And with these, before completing my this abstract presentation, I would like to share some 8 to 9 points which are very much closely related to the use of ashwagandha. So one is ashwagandha is very much helpful and beneficial in reducing anxiety and stress level, not only in the already stressed individual, but in the overall community which people are stressed with workload or with some sort of family issues or other mental disorders. The use of ashwagandha for 8 to 12 weeks have remarkable effects on their mental health. The second one is the mental health improvement, the brain functions, the memory power improving, especially the long-term memory. Ashwagandha have a very great effect in the long-term memory improvement of the individuals. And one important thing is it increases testosterone levels, which is very much important in men fertility issues. It increases brain function and memories as well, and it have a very good role in increasing cognitive learning, and especially individuals who are in adult age. And also, ashwagandha have a great role in sleep pattern. It have a good, as also it's clear from our data that the patient, the group which were given the 300 milligram dose of ashwagandha, they have good quality of sleep. And the last one is it's very easy, safe, and it's without any side effects. So this is one of the herb which we did research on this topic, and or as far as our research is concerned, it have good effect on stress levels, they decrease it, and also on the sleep pattern of individuals. I will recommend that ashwagandha should be used on population level, not only to the by the patients, but it can be used by the normal individual for their normal well-being and good health as well. So thank you very much. This is all from my side. Any question is welcome, please.
Thank you so much, Dr. Latifullah Fatak, for such a grateful insight. Uh, Now I would like to Dr. Anita Ji. Are you ready, Dr. Anita Ji?
Please, be audible. Zilam, increase your volume so that you'll be able to pick up what you are saying. You are sounding very faint in my location. Thank you.
Hello, Dr. X.
Sorry, raise up your volume, the voice of your volume a little bit so that you'll be able to pick your sound and pitches.
Okay. Dr. Anita Ji, are you there?
Yeah, Dr. Anita is there. Dr. Anita Lee is there. Very much.
Yes, sir. Yeah.
Yeah, yeah. And Dr. Latif, I just take 1 minute. Dr. Latif, you very well you said about the role of ashwagandha.
Yes, sir.
And very well, but this is the right way of putting the things, and I must compliment you for your great work, research along with your colleague. And this is the right way of giving this thing so the patient can have a good sleep. At the same time, no mental depression should be there. So it's a beautiful way without any side effect, because ashwagandha is known since ages to us.
Yes, sir.
Right.
Yes.
So excellent, sir. Excellent. Very
Thank you,
crisp
sir.
talk, but to the point talk, sir. Very nice, sir. Compliments to you, sir.
Thank you, sir. Thank you.
Dr. Anju, ma'am, you're mute. It is mute. Yeah. Okay.
Dr. Anita, are you ready with your presentation, ma'am? Dr. Anita?
Let somebody unmute her. It's like she's talked. Let somebody unmute her so that she can speak.
I think she's not ready. So, anyone who, Riva Munir, are you ready?
Yeah, I am ready.
Please go ahead if you're ready. Ma'am, kindly share her PPT.
I'm audible.
Yes, ma'am, you are.
Hello, good evening to everyone. First of all, I am thankful to all chief guest speakers, moderators, and all team members of IIU Medical Council for organizing such a wonderful international conference on traditional, complementary, and alternative medicine on 2024. I am Ariba Munir. I belongs to Bahawalpur from University College of Conventional Medicine. I am preceding my education from University College of Conventional Medicine, Islamic University of Bahawalpur. Thank you so much for giving me opportunity for presenting my topic, wound healing through complementary and alternative medicine. First of all, we will see some terms like complementary medicine, alternative medicine, holistic medicine, complementary and alternative medicine. Alternative medicine is any practice that aims to achieve the healing effects of medicine despite lacking biological plausibility, testability, repeatability, or evidence-based effectiveness. Complementary medicine is a term for treatment that are used alongside traditional Western medicine. The term complementary is used to describe treatment that are used in addition to conventional medicine, while alternative is used to describe treatment that are sometimes used instead of conventional medicine. Complementary medicine includes acupuncture and ancient Chinese practices that use they use a thin needle to stimulate specific points on the body. And homeopathy also includes in complementary medicine in which this idea was developed by a German doctor in 17th to 19th century. Ayurveda also includes in complementary medicine in this the practices that focuses on maintaining all aspects of life and to promote health. Massage is also a physical therapy, and where specific parts of the body are stimulated, and presses or kneaded or rubbed by a oil to soft tissues of the body. And meditation, a psychological complementary therapy. And dietary supplements include some vitamins and minerals, and through which we can heal our wound. Next, complementary and alternative medicine, in which is a group of systems of mind body intervention, where includes meditation, yoga, hypnosis, and manipulative and body based practices include chiropractic. And chiropractic is also a therapy where manipulation of the spine, joints, and skeletal systems is includes. And reflexology is also a type of massage in which pressure is applied to specific points on the feet or hands, which are believed to match up with certain parts of the body. And energy healings is based on the belief that vital energy flows through the body. The goal is to balance the energy flow in the patient. So there's not enough evidence to support the existence of energy fields or some harmful effects in using such approaches, such like therapeutic touch, moving hands over the energy field of the body, or gently rubbing persons. Ayurveda medical medicine is a system which used in India, in which the goal is to cleanse the body and restore balance to the body, mind, and spirit. It uses diet, herbal medicines, exercises, meditations, breathing, physical therapy, and other methods. Acupuncture, it is most common in Chinese, where the stimulating certain parts to promote health and or lessen the disease symptoms and treatment side effect. Next, we will come to our main point, which is wound healing. Wound healing refers to the body replacement of destroyed tissue by living tissue. Wound healing is a process by which the body is trying to achieve anatomical integrity of the injured part and restore function, how its function normally. We will see how many challenges are facing in wound healing. In wound healing, the high level of inflammatory cytokines and low-grade infections and antioxidants. In any wound healing, we needs antioxidants in excess amount, and anti-inflammatory factors also included in wound healing, and growth factors and angiogenic factors are responsible for healing of wound. For healing any kind of wound, we used these factors, these inflammatory mediators, antioxidants in excess amount. Now we will see how our wound will be healed. If any, we will see there is any injury or wound, the first symptoms which appear on that side will be bleeding on that side and injury. And there are 4 phases after which the wound will be healed. The first one is the homeostasis. This phase will remain up to hours, and the next phase will be inflammation. At the site of injury, at the site of wound, the inflammation will be started and it will be remain few days, 2 to 5 days. And the next is the proliferation. At the site of the injury, proliferation will be start, and up to 3 weeks this phase will remain. And next, the fourth phase is the remodeling, and remodeling up to 2 years this phase will remain, and the new healed tissues will appear. In the wound healing, the first intervention, the cell proliferation, formulation of granulation tissue. Up to 3 to 7 days, this will remain, and formulation of larger amount of granulation tissues form, and the our wound will be healed. Wound healing factors which depends on wound healing. The factors will be local factors and systemic factors. If we see local factors includes oxygenation on that site and infection and foreign body invasions and blood supply. If at the site of the wound blood supply is compromised, then the wound healing time will be increased, and it will take more time to heal any wound. And systemic factors includes age of a patient. If a person is young, and then its wound will be healed very rapidly. And if a person is old age, like 50 to 60 years old, then its wound will be healed takes more time. And also factors include the gender. Female wound heal more, male wound heal rapidly as compared to female wound. And obesity and medications also includes, and lifestyle. If a person is lifestyle include alcohol, he used too much alcohol and smoking, and it's stressed patients, then its wound will take too much time to heal. Now we will see there are many herbs and supplements that can help in the wound healing. The first one is the aloe vera. Aloe vera is a perennial herb that are used topically as a cream or gel to reduce inflammation and soothing, provide promote healing. And you can say here the images of aloe vera. Aloe vera provided as a is used as a gel or cream, and it is used topically on the side of a wound. And calendula, also known as port marigold, this herb can be used to as a ointment or tea to stimulate collagen formation, reduce inflammation, and also act as an antiseptic. And marshmallow can also be used as a topical ointment to help wound heal and fight inflammation. And witch hazel has astringent properties, and that can help to dry oozing and bleeding wound. And supplements which is used in wound healing is slippery elm and plantain. It contains mucilages and which provide soothing and protective coating. And glutathione is also used as a supplement. It is also an amino acids that can help with tissues repair and strengthening the immune system of a person, and so a person can heal very rapidly. That's all about from my side. Thank you so much for joining us.
Thank you so much, Ariba, for such a grateful insight. Your content is truly relevant to the conference agenda. So now I would like to Salini Das.
Yes, sir.
Are you there?
Yes, I am here, sir.
Sir,
Can
I
you
just
hear
want, Jishan sir, just I want to compliment Dr. Ariba. for the wonderful work which has been shown here, especially on the aloe vera, the way you have spoken, the multiple ways that you are talking about it. That's the real need of the hour. It is not going to hurt the human body. At the same time, it is going to help to recover from the ailment which is there. So you are putting it in the true possible way to elevate the human suffering in the required way, which is required, which is available since ancient time. So thank you, Dr. Ariba, for your wonderful and great work which you have presented is today. Compliments from my side as well. Thank you. Shukriya. Over to Jishan sir.
Uh, Thank you so much, sir, for great suggestion and appreciation. So now I would like to Salini Das,
Yes, sir. I'm here. Am I
who ma'am
audible?
share.
Good
Yes, yes.
Yeah, good evening, ma'am. Good evening, sir.
Good evening, ma'am. We would request you to switch on your camera. It's
Yes,
always
ma'am.
nice. Yeah.
Good evening, ma'am. So I'm sharing my presentation. Should I start now?
Yes, sir.
Okay, thank you very much. Is my screen visible?
Yes, ma'am, it is.
Thank you very much. Thank you to the organizers, IIU, for collecting and selecting my abstract for this presentation. This is a very good platform from where we can virtually share all the knowledges and ideas and new research concepts. And the particular topic of this conference was very much interesting. So I considered myself my very small research work, which is wholly computational and in silico based, to share with you. So today the title of my presentation is Conjugating Two Drugs in Silico Using Computational Methods to Design and Evaluate the Interaction Between Two Drugs. Myself, Shalini Dash, International Innovatory Program PDF Fellow from Eudoxia Research University, USA and Eudoxia Research Center, India. So my abstract of my work is simply concerned on how we can repurpose a conventional drug and can conjugate that with is a presently available phytochemical soybean isoflavonoid genistein with a common drug analgesic antipyretic drug aspirin to create an anti-cancer potential out of it. So we will discuss here how we can do it totally in dry lab method. It is the initiation phase, of course, but we can get some references from the literature, and the modern day technological advancement and artificial intelligence had made it very possible to start drug discovery within our bench top. Here we have used several references from drug bank, and we have got selection of correct molecule, then docking and binding with them, creating in silico approach of pharmacokinetics to show the drug-like potentials of this. So what are the steps one should start in order to drug discovery process in silico method? First of all, you have to select the drug. The molecular structure should be available for the biosafety, as well as when it is consumed within the body, the bioavailability would be there and it should be within the safe limit. Next, because I'm working with conjugation with two drugs, so here docking or connection between the bonds needed to be explored, for which Autodog Vina is a online software where you can perform binding of two molecules and you can see the compatible sites where the bonds can be created and how it will work. Third, molecular dynamic simulation. It actually shows by references that in case of physiological system, how this kind of molecule act in order to create the drug-like effects. Next is binding affinity and free energy calculation. By doing the binding affinity and free energy calculation, we can show that how much it will be stable, because most of the cases, the problem with the drugs that it will be decayed, degraded, it will be not available, it can be readily excreted out. So these are the problems can be there. Next is the ADME. So absorption, distribution, metabolism, and excretion analysis. So for which we need to do the pharmacokinetic properties to the conjugate to ensure the favorable drug-like properties. Next, there are density functional theory calculation, which shows the electronic structural analysis. And finally, in order to get it, we have to do experimental thing. And there we can finally get the result. Importance of bioinformatics in cancer, because my work of PhD was on cervical cancer, and in postdoc I'm working on lung cancer. So we need to show how bioinformatics can be used for cancer. So cancer bioinformatics play major part in the identification of biomarkers as well as for novel drugs, whether it will be applicable for the more important oncoproteins where it will be acting on that can be helpful, and these informations can be provided from bioinformatics. So first I am starting with acetyl salicylic acid, or commonly known as aspirin. It is most commonly known analgesic and antipyretic, the fever curing medicine. So there, besides its conventional uses, there are beyond its limitation and potentials. So where we can see that it can protect safe tissues, by replication dependent sensitization. It can cause cell cycle arrest. It can cause induction of apoptosis, and it can cause prevention of DNA repair. So overall, this medicine can cause anti-cancer potential because it can kill the cancer cells specifically. Why? Because cancer cells are highly proliferating. Its cell cycle timing is much lesser than the normal cells. So when aspirin can detect the highly rapidly proliferating cells, majorly which will be at the S phase of cell cycle and commencing towards the G2 phase. So in that particular phase, aspirin can act and can cause cell cycle arrest. Now, because we are talking here about alternative medicine, so phytochemical, soybean, from which we can get a potential chemical, which is genistein, which is an isoflavonoid. And being an isoflavonoid, it is antioxidant in nature. It has anti-inflammatory potential. It has been from our earlier works we have done and shown that it can cause cell cycle arrest. It can cause apoptosis or programmed cell death to the cancer cells. And it can cause induced DNA damage to kill the cells with the help of radiation. So this molecule also has a potency for its anti-cancer approach. Now, my objective is to combine these two drugs and see whether these two molecules can be effective and much more efficacy can be shown in case of cancer. So as we know that genistein, it is also a phytoestrogen. So it can act on prostaglandin, it can act on transcription factor, nuclear factor kappa B, it can cause inducible nitric oxide synthase, pro-inflammatory cytokine, and cell cycle arrest and apoptosis. And acetyl salicylic acid is a COX-2 inhibitor. It can cause cell death and also have anti-cancer effects. So first what we did now, drug bank. This is an online server where there's a new feature available where you can see for drug discovery, you can explore whether there are drug-drug interaction possible or not. So first we checked the drug-drug interaction potentiality. There we could find there is a moderate drug-drug potentiality, and importance is that in aspirin is readily soluble in water and it can be excreted out. So the stability of aspirin can be increased when it is combined with genistein. So first we have done some work on our cervical cancer cell line SHIHA and its radio-resistant subline SHIHA-RR, and with 1:1 ratio of aspirin and genistein combination, we performed MTT assay, and there we could show that increased cell killing was found when we applied this combination of drug. And there we could see that the IC50 value was much reduced in the presence of the combinatorial treatment. Not only that, important biomarkers like NF-kappa B, AKT, HIF1 alpha, GAT45 alpha, aurora kinase A, P53 were much more downregulated. Keeping on this mind, now because we are going to conjugate this drug, we wanted to do the docking. So the criteria is docking score and confidence score and ligand MSD. So docking score, if it is done on IT score PP platform, where you could see that the score, negative score will be much more effective. In case of confidence score is also that when we, if using the formula which is shown on the screen, we have done the confidence score, and the if the confidence score is between 0.5 to 0.7, there is moderate docking present. And the RMSD value of the ligand will help in the model structure. So here, after docking from autodoc vena, we could see the structure. So where we could find that the molecules where has an interface of binding. These are the most 3 important structures found then, and these are the top 10 potential binding. You can see from the screen that the docking score came out in the negative and the confidence score was within 0.5. So therefore, and ligand RMSD was also quite important. Now using another molecular tool, which is Swiss ADME, it is also online server. We drew the chemical structure and replaced the alcoholic groups with methyl group to see what can be done. So there we could find the molecule upon drawing on this Swiss ADME, it is highly lipophilic molecule. Being lipophilic molecule helps because it can be readily available to the plasma membrane. It can cross the barrier and can be available to the cell. Not only that, it can be readily targeted and can be delivered to the body using vesicles, which are made up of phospholipids as well. So then what is ADME? ADME at the 4 step. Number 1, absorption, where we can see how much it is soluble or it is permeable to cell membrane or not. It can be, many drugs have pH dependent soluble, and there we can see at different pH level how it is acting, and it can be helpful for in silico modeling also. For distribution, we can see how it is binding with proteins, whether it can cross blood-brain barrier or not, how it is distributed in the tissue. In case of metabolism, we can see whether it is interact with cytochrome P450 or not, and other metabolites. And excretion, how it is getting excreted, whether it is cleared from hepatic system or by renal system, that can also be predicted. So using that Swiss ADME, we could get the formula, which is C23H42. Molecular weight is around 318.58. There are 23 heavy atoms present, and the molecular reactivity is 106.33. And the log values showed that this is highly lipophilic in nature, which has higher values of lipophilicity, which means it can cross the plasma membrane barrier. Not only that, it shows poorly solubility in water and moderately soluble when added with some ions. In my pharmacokinetics, we could see whether because it was only in the in silico method, we could see it can be absorbed by GI, but at a lower extent. And it is most importantly cytochrome P1A2, cytochrome 2C19. These inhibitors are interacting. This is acting as an inhibitor of this molecule. So it can show some kind of drug-like activity. Because in case of cancer cell, if we can target these essential cytochrome components, then we can shut down their cellular respiration. As a result, we can targetedly kill the cancer cells. So, and according to the bioavailability score, it was 0.5, which is moderate bioavailable. That means it cannot be readily cleared. It has a moderate stability as well. So with further physical or further chemical modification in future, and also of course with experimental changes, there is a potential of this conjugate to behave like a good drug. So this is the tool where we have used. Here is the screen where you can draw the drug according to getting the potential sites. Other than that, there are Gaussian, Quantum Espresso, VASP, and Orca. These are the softwares available for in silico drug designing and simulation. And after anything, you need to show some regulatory criteria, which are FDA and EMA guideline, where you can see whether it is safe for use or not, where it will be commercially available, whether it should not have any legal issue while commercializing this thing. And also, of course, there should be good laboratory practice when it will be actually used in vitro or in vivo system. So best practices should be there. The right basis of set should be used. So computational resources, size, complexity should be there. And the convergence criteria should be there. And the result should be validated by DFT analysis. Thank you very much. This was my presentation.
Dr.
Thank you
Shalini
so
Das,
much,
Dr.
Sarini.
Shalini Das, very well you presented it, and I can make it out as a farmer person that how much work you have added in that, how beautifully it has been incorporated, and the outcome which is coming up, it is really truly commendable. So my heartiest congratulations to you for such a great work, and the impetus which is coming up with this, it is really appreciated. So thank you so much for making it happen. Thank you. Thank you, Jishan sir. Over to you, sir.
Thank you, Sarini ma'am. Thank you, sir, for such a great presentation and presentation. Now I would like to invite Dr. Anita Lee. Uh, are you there?
Yes, sir, she is there.
Yes, I'm here.
Please go ahead if you're ready.
I'm here. Can I start?
Yes, you can start, ma'am.
Okay. Greetings to you all. My name is Anita Lee. I'm here to talk about traditional methods for preparing medicinal herbs in Nigeria. We have a lot of herbs, but I'm just going to talk about 3. Traditional medicine refers to the knowledge, skills, and experiences indigenous to different cultures. Importance of them: traditional medicine plays a vital role in healthcare delivery in Nigeria. Medicinal herbs are plants or plant parts used for medical purposes. Medical herbs are cornerstones of traditional medicine in Nigeria. Traditional method for preparing medical herbs. We have so many ways of preparing it. We have a decoction, boiling plant parts in water to extract active ingredients. Infusion, steeping plant parts in water to extract active ingredients. Maceration, soaking plants in a solvent to extract active ingredients. Fermentation, allowing plant parts to break down naturally to extract active ingredients. There are also spiritual and ritual practices. Spiritual and ritual practices refers to use of spiritual and ritual techniques in traditional medicine. So I'm going to talk about 3 herbs here. I am here with them here with me live. I'm here with them live, which I am going to show you. The number 1 is red jatropha. This is the red jatropha. This is what red jatropha looks like. I don't know if you can see me.
We can.
This is red jatropha. Red jatropha leaf. It is very, very good for treating or to cure HIV. HIV, not AIDS. It brings HIV down. It cures HIV. It helps in curing HIV very, very well. It is anti-HIV. Then this one you boil. You boil it. When boiling, you add what we call garlic, ginger, cloves. I have my cloves here. I don't know if you are seeing it. I have my cloves here. This is my cloves. So many of us know what cloves are. And there is another one, very, very powerful too, and so special too. This is it. It is called Adian fruit. Adian fruit. You add to it when boiling this jatropha leaf. You add it to it. This is Adian fruit. Another name for it, we call it prekese. Ghanaians call it prekese. Then this prekese also is very good for menstrual. That is what I mean by menstruation. Sorry. Especially for we women, it is very good for menstrual. And when you are done with your menstrual, you boil it and drink it. It is very, very good. It is very, very effective. Then I am going to talk again about goosegrass. This is my goosegrass here. Like I said, I'm showing it live. This is goosegrass. This is what goosegrass looks like. This is the goosegrass. This is the root. Each root has a very vital role when it comes to curing many diseases. This is goosegrass. Here with me is goosegrass. This goosegrass has been used to treat minor cuts, scrapes, and burns due to its antiseptic and anti-inflammatory properties. It can also help to relieve constipation. This goosegrass is very, very good in constipation and promote regular bowel movements. Goosegrass tea might help soothe digestive issues and reduce diarrhea. It is very, very good in diarrhea. Yeah. The herbs has been used to treat urinary tract infections, kidney stones, and other urinary problems. Goosegrass has anti-tumor. It is also very good in anti-tumor. Very powerful for anti-tumor. It dissolves anti-tumor and anti-cancer property, which means this goosegrass can cure cancer. It is very, very good in cancer when it comes to cancer. Very, very good in cancer. So I am still going to explain the third one. The third one, which is spinach. This is here with me, spinach. This is spinach. This is what spinach looks like. This is spinach. I don't know if you are seeing me well. This is spinach. Are you all seeing spinach? Yes, this is spinach. Spinach is rich in vitamins C and E. Spinach is an excellent source of vitamins A and K, as well as minerals like iron, calcium, and potassium. Spinach is a very good source of dietary fiber which can help promote digestive health and support digestive health and support healthy blood sugar levels, which means it is very good in diabetes. Yeah, a diabetes patient, when you take it, in this one, you boil or you squeeze. Sorry, I didn't explain how to use that goose grass earlier. The goose grass too, you boil it as tea. You take it as tea. Yes, you have to boil. You have to boil. You wash it with the roots. You make sure that the root is there. When washing, don't remove the roots. This is the roots. The root has its power of healing too. You boil as tea and drink. Then the spinach, you squeeze, either you squeeze, extract the water. It is also good for sauce. When you are making sauce, you add it. It is very, very good for diabetes. It's good for low sugar level. Yes, it is very, very good for sugar. When you want to bring your sugar down, you go for spinach. Spinach may help reduce the risk of chronic diseases like heart diseases, diabetes, and cancer. It is also good in cancer. It is also good for cancer, sorry. It is also good for cancer. Spinach make it an excellent food for supporting eye. For eye, it is also good for eye. Eyes, it is also good for eyes. Eyes health and reducing the risk of age-related macular degeneration. Maintaining strong bones, healthy strong bones. Is also good for healthy bones. It is very, very good in healthy bones. It is also good for our eyes, for sight. Now, like I was saying before, the spiritual and the ritual practices emphasize the holistic approach to healthcare in traditional Nigerian medicine. Holistic approach to healthcare. Holistic approach to healthcare refers to the consideration of physical, emotional, and spiritual factors in healthcare. The holistic approach to healthcare in traditional Nigerian medicine emphasizes the interconnectedness of physical, emotional, and spiritual factors. Challenges and limitations, lack of standardization and regulation, limited science evidence, potential interactions with conventional medications. Yeah, why we are saying all this is there are so many ways of preparing these herbs. Why I didn't talk of soaking? I did not have anyone to soak here. The 3 herbs I talked about are cooking. 3 of them are cooking. Then the herbs that we are supposed to soak, if you are supposed to soak herbs, is either you are soaking the stem of the herbs. Yes, these stems are good for soaking when it comes for soaking herbs. But this one is cooking. This goose grass is also cooking, you boil. This one also is eatable as vegetable. Yes, and when somebody lacks blood, when somebody needed blood, it is very good when you squeeze it, extract the water, add milk, and give to the person. It boosts blood. This spinach boosts blood like magic. It works wonder when it comes to boosting of blood. Yes, you squeeze it, add liquid milk to it, not powdered milk, liquid one. Liquid milk, you add it to it and drink. it boosts blood like magic. So this one, you don't soak. This one is either you cook as vegetable or sauce, or you squeeze and drink, squeeze it and drink. Then this goose grass, you also boil as tea. This one you can boil 20 minutes, 15 to 20 minutes, it's done. Please, when you want to boil this one, you make sure you wash the root very well. This is the root. The root itself is very, very effective. You wash. When you wash the leaf thoroughly, you just put in a pot or in a kettle, boil for 20 minutes and drink. It is also good for stroke. Yes, it is also good for stroke. Goose grass is also good for stroke. The stroke, when you want to make it for a stroke patient, when you are boiling it, you add your cloves, you add cloves to this, you add what we call lime, and you add your Adian fruit again. Yes, Adian fruit is needed when you want to treat stroke with this goose grass. Goose grass is a very strong herb that many people don't know about. Even in my place, in Nigeria, where I came from, if you are going to a party, that one is another one. Just to tell you how strong this grass is, if you are going to a party, you hold it, just put it in your pocket. It is anti-witchcraft, this goose grass, anti-witchcraft. Yes, anti-witchcraft, this goose grass. It is very, very powerful. Then this one too, I've explained how to use it. You boil. So what I'm saying is all the three herbs are explained. I don't have any one for soaking. So that is why I am explaining. Most of the soaking herbs is the stem. You soak the stems of it, or the roots. That is what we soak. These leaves, we don't soak leaves. You either boil leaves or you squeeze them to drink. I hope I'm making sense.
Yes, you
Yes,
are.
yes, carry on.
Yes, please.
Yeah. So, summary of all I have been saying, traditional method for preparing medicinal herbs in Nigeria includes decoction, infusion, maceration, and fermentation. Further research is needed to standardize and regulate traditional medicine practice in Nigeria and globally too. Sorry, globally too. Don't mind me, I'm kind of nervous. Actions, sorry. So these are the three herbs I have to explain. And just like I said before, just like I would have talked about Lantana Camara, but I don't have the leaf here. Lantana Camara, I don't know how many of you that knows it. Lantana Camara is also a very good herb for treating rheumatism. Yes, nails pain, ankle pain, and all that. And it's also good for anti-poison. It is also good for anti-poison. So for us ladies who are here, please, if you get your hands on these plants, oh my God, you have gold with you. Why I say so, it is very, very good for us. It is very, very good for us, the ladies, especially after our normal monthly flow. Yes, you go for this. You pieces it, just pieces it and boil. Or you soak. Yes, you can soak this one for like 7 days. That is where you get the result very well. If you leave it in water, or if you want to boil, you add your cloves. This is the cloves. I don't have enough cloves here. The ones I have, I've used it. This is the cloves. This is the cloves. Cloves is another strong herbs. Cloves is another strong herbs that we can be using. It's good for tea. It's also good for eye. Yes, when you soak it for 3 days, use it to wash your face. It clears eye. It clears eye, makes you sight well. Yeah, and it's also good for love attraction. And it's also good for mouth odor. Mouth odor. Yes, it's also good for mouth odor. You soak and you drink. And then it's also good for weight loss. When you want to lose weight, it's also good when you drink it every day. If you take it every day, it's very, very good in weight loss. So that is all from me, Anita. Thank you. Thank you.
Thank you so much.
Very well, Dr. Anita, you have shown actually the thing, what is there. So we will be able to resonate it, which is really required, that what are the things are there, what are different medicinal herbs, the roots are required to take care for the different conditions of the human health. Very nicely, it has been described. Since I keep on coming, I was coming to Nigeria, I understand how the people from Africa, from Nigeria, they love to have such type of things to take care for their entire system, and they are promoting it, the alternative medicines, right, in the either from the hospital or the different practitioners. So very well you have described, and kudos to you and salutations to you for your fantastic and great work.
Thank you.
Thank you so much.
No, and I love the patience with which you took to explain and give us, in detail information what are the things that we need to soak and what we can use as foodstuffs. So you're very particular about, okay, you can only soak a stem and you shouldn't soak leaves. So that is a very nice way of explaining the use, which I think all of us, at least I found very interesting, because we tend to overlook those things when we are using even vegetables. So very, very interesting to know a
Thank you
lot
so much,
today.
ma'am.
Dr.
Thank
Zishan.
you.
Anju ma'am, I will be taking your leave now.
Yes, sir.
Right. Thank you so much. Thank
Thank
you
you
very
so
much
much,
for
sir.
inviting me. Thank you, all the great participant, all the learned people, all the doctors, all the people who are making it happen. And your work is really incredible. It has to be explored in the bigger platform the way IIU is doing it. Thank you. Gratitude, respect to everybody.
Thank you so much, sir, for sparing these moments with us.
Thank you, ma'am.
Always a pleasure to have you on board. Thank you, sir.
Thank you.
Dr. Zishan?
Thank you so much, ma'am. Such a brilliant insight and took the shrubs and other things to show us practically that how it is well. Now, I would like to invite Miss 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 Peace. Are you there?
Yes, she is there. Dr. Peace?
Dr. Peace, are you there?
Yes, Zishan, sir, she is there. Dr. Peace, you need to unmute yourself, please.
Yeah, good afternoon, everyone. Good afternoon, everyone. So Peace is here. Good afternoon.
Oh, thank you. Thank you. Thank you.
Okay.
Go ahead, please.
Okay. My name is Dr. Peace Ibumara from Nigeria. I'm a medical practitioner practicing based in Niger State here in Nigeria. I'm here to talk about I'm here to talk about the complications emanating from traditional birth attendance. Are you hearing me?
Yes.
Okay. So I'm going to speak on complications emanating from traditional birth attendance. And when I talk about that, I'm talking about that traditional birth attendants are those
Dr. Peace, would you like me to share your PPT while you speak?
individuals who assist.
Yes, Dr. Andrew, please, yes, share her PPT.
Just give me a
Okay.
second. Just give me a second.
Okay. I said traditional birth attendants are those individuals that assist with in child delivering. They are often resource poor settings, understand? And these individuals are unprofessionals. Some of them are unlicensed and unqualified. So they are not educated to take care of the births, but yet they go ahead and take birth and save life with so many complications anyway. So traditional birth attendants, their importance, they are very important. They have a significant role in maternal health care, but their practices can lead to complications. Their practices can lead to complications. Okay. Just go to the third page. Yeah.
Third one.
Move the slide. Yes. Okay.
Okay. Third one. You can tell me which slide you want me to move
okay.
to.
I'm here. There.
Yes.
I'm okay here. I'm okay here. Okay. Having said that, I'm going to classify it into maternal and neonatal complications. Anyway, under the maternal complications, we have sepsis emanating from infections emanating from sepsis, hemorrhagic shocks, and also obstructed labor and fistula. Other ones are uterine atony, uterine rupture, and cervical lacerations. These are the complications that can emanate during the traditional birth attendants because some of them are not licensed to operate as a medical practitioner, and they end up having so many complications during their childbirth. And another one is a kind of convulsions that can arise from eclampsia per se, and leading them to unconsciousness and brain damage, which can lead to death. So these are the complications. And further explained, I want to explain it one by one, like infections and sepsis. Infections and sepsis, they are life-threatening complications that can arise from hygienic practices. That is go to the fourth slide. Move the slide. Okay. So I just want to tell you that the causes that can emanate from these infections and sepsis is as a result of unhygienic practice, lack of poor equipment, delayed referral to the health care facilities, and those will emanate to consequences, and those consequences are maternal and neonatal mortality and morbidity, which is not appropriately okay, because some of them don't know the time to refer and they don't even know what to do at a particular time. That is why it is more obvious that their assistance is having more complications. The next slide, please. Yes. Under the hemorrhagic shock, you will see that hemorrhagic shock is also a life-threatening complications arising from uncontrolled bleeding. And this uncontrolled bleeding can as well result to hemorrhagic shock and death as well. Lack of proper equipment can as well cause hemorrhage as well. And delayed referral at the health facilities. So all these can result as consequences of maternal and child health, maternal and neonatal mortality and morbidity, and is not okay. It's instead of causing good, it's causing more harm, bringing a lot of complications. Move to the next slide number 6. When we talk about obstetric labor and fistula, we talk about all those complications that can result as a result of labor and fistula, obstetric labor and fistula, and these these are the causes. It causes prolonged labor. Prolonged labor causes obstetric labor and fistula, because if they do not guide the perineum well while they are delivering the child, they might have a third-degree tear emanating from that delivery, and you know that the vaginal wall, anterior wall connected to the posterior wall is connected to the rectum. So if peradventure they did not guide the delivery well, it might also lead to fistula, anal fistula. thereby destroying a lot of, emanating a lot of infection to the vaginal wall. And again, let me say that if they do not guide it well, they might rupture the bladder wall, causing a vaginal, there's a vesico-vaginal fistula, which is one of the complications that can arise as uncontrolled birth attendance if it's not right. Okay, go to the next slide. Go to the next slide. Having said that, I also talk about the neonatal birth asphyxia. Neonatal birth asphyxia, as we know, are the complications that arise as unhygienic practices and lack of proper equipment. So on this, we have the causes are unhygienic practices, lack of proper equipment, delayed referral as well. Some of them, they will deliver the baby without knowing that the baby is asphyxiated because they are not professional and they are not learned. So at this note, they will think they are doing well, rather they are causing more havoc. So it's not right, and it's not okay. This will result as a consequence of maternal and child health, maternal and neonatal morbidity and mortality, leading to long-term disabilities. Okay, so move the slide to management strategies. Let's see the management strategies. Okay. I just want to tell you that some of the ways that we can manage and overcome these complications are: one, by training and retraining the traditional birth attendants so that they can be able to know the do's and the don'ts and when it's required to refer at the appropriate time. Next is a collaboration with the skills birth attendants. We have to collaborate with them and teach them exactly what we want to do so that they'll be able to know the limits they have to undergo, because some of them are not qualified and they are unlicensed, so that they as soon as the child is being delivered and has some complication, they should refer as fast as possible to save the life of that neonate. That brings us to referral system and emergency prepare. Yes, they should know the limit. By teaching them with good, adequate, and good health education, they'll be able to know the limits and don'ts of them not to delay the cases. Another one is the community education and sensitization. We have to go to the rural areas, tell the imams, tell the pastors, tell the rural community areas, tell them exactly what they want to do and what they need to know about traditional birth attendants. Because if you don't educate them, they assume they are doing right, rather they are causing more harm than good. So it's not right for them to deliver through unsterilized instruments. If you tell them that, we'll be able to curtail infections and diseases that can emanate from that, because some of them use unsterilized instruments and do what? And transmit so many diseases such as HIV/AIDS, hepatitis B, venereal diseases like syphilis and all the rest. So they should be able to do exactly what is right through community education and sensitization. So move to the next slide. Training and referring of TAPs of traditional birth attendants. The importance is that in training them, you can be able to that is maneuver, tell them exactly what they need to do, so they'll not be able to go back to unsterilized instruments. In training them, you'll be able to organize yourself and do exactly what you needed to do, because all those traditional birth attendants, they are not qualified, and when they are not doing the right thing, they make a lot of mistakes. So I just want to tell you that traditional birth attendants, they are okay in their own eyes, but not too okay, because they cause a lot of havoc than good. Although they are doing well by saving lives, but most of the lives end up having a higher mortality. So move to the next slide, please. Okay, as I was talking, I said training and go to the training and retraining of traditional birth attendants. It's good to train them so as to know what on the training, they should be trained on their work services. They go to workshop and seminars, and also they mentor their programs. So those are not qualified candidates to deliver birth attendants. We have to give them seminars. We have to teach them. We have to organize programs and mentor them so they'll be able to know that the rules and don't what they're supposed to do. Because life is just once. If you miss it, you have missed it all. Go to the next slide. This next slide is collaboration with skilled birth attendants. Are you there? collaboration with birth attendants. The importance is for us to have a skilled attendants that can remove maternal and neonatal outcomes. You understand? So that they will not be able to consume more nuisance than good. These strategies including a referral system, emergency programs, and joint training. So at this note, we have to have a joint training with them, teach them the professional ethics and etiquettes that can guide them so that they'll not be able to make mistake while delivering those children in those remote sectors. Move to the next one, which is the referral strategies and emergency preparations. Okay, yeah, there. Referral system, at this one, we have to refer them as urgent as possible. And while doing that, we have to map out strategies such as establishing referral systems, conducting emergency drills, providing emergency equipment and supplies. Then community education is also necessary. The next slide. Community education is also necessary. Community education and sensitization. We'll sensitize them and educate them for them to know the neonatal outcome after delivery, so that they can be able to do what? They can be able to conduct community outreach program for them and provide health education and engagement in community leaders and strategies. So this will help them to do exactly what is needed. And the next thing is, if you do not educate these traditional birth attendants, they will have more mortality rate than necessary. Because with this, we can be able to avert such predicament that can arise from these traditional birth attendants. As a professional, you have to guide them so that they'll be able to avert such complications and save lives. Our priority is for them to be educated and save lives instead of causing more complication than good. At this note, I want to conclude by saying that, in summary, complications arising from traditional birth, from the practices, that is go to the conclusion, my dear. I said that can be managed thoroughly. It can be managed thoroughly, and the training in collaboration with skilled birth attendants, referral system, and emergency preparations can help us do what? Curtail all these incidences. And I want to recommend that some of them should go to school and be nationalized and practice adequate practice, and not a kind of a rural practice without license. If they can go to school and have more knowledge, they'll be able to do exactly what is right to save life, because life is so precious. On this note, I want to encourage the traditional birth attendants to collaborate with the professionals to do the ethics and etiquette that governs the system, so that we will reduce mortality rate and we'll be able to save lives accordingly. Thank you very much for listening. I appreciate you.
Thank you so much, Doc. Thank you so much. I think it was superb understanding how.
Yes. If there's questions, I'm here to attend to questions.
Yeah. No, but it was wonderful to understand how, maternity complications arise and what are the ways in which we can avert some or manage them. Dr. Zishan, please continue.
Thank you so much, Dr. Peace, for such a grateful insight. And I think it is needed to address these things. Now, I would like to invite Mr. X who share their experience or such aspect as they want. Dr. X, are you there?
Yes, is there? Dr. X, are
Yes,
you ready with
yes.
your presentation, sir?
You said?
Are you ready with yours? You had also wanted to share some info about medicine, if I'm not wrong.
Oh,
Would you like to speak about
well,
your abstract?
my abstract, because when I saw the the pile-ups. I didn't see me presenting. I was more or less in the moderation.
But
So,
you have it, so we could hear what you want to say.
okay.
We would love
Okay,
to
no
hear
problem.
your about it.
No problem. I will do something now very quickly.
Yes. I think you've shared your PPT with me, right? So I could
Yes.
I could share that and you could just take it from there, sir. Yeah?
Please go ahead.
Yes.
Please go ahead.
Just give me a minute, sir. Just give me a minute. Let me
All
just
right.
in the meanwhile, you
All
could
right.
just I don't know what I've done. Just give me a minute, sir. You can continue to talk a little bit about your abstract while I get your PPT, sir. Just allow me.
All right. I'm gonna do just that. Just a moment.
It's exploring traditional medicine, right, sir?
Yes.
Yes, I have it here. No worries at all.
Welcome.
Just take a minute to just give me.
My topic is the exploration of traditional and alternative medicine. So here I go. Ladies and gentlemen,
I will share
thank
your
you very
PPT.
much. All right, thank you very much, IIU, the organizers, guests, and distinguished speakers. It is my singular honor today to make a little token of my presentation about exploration of a traditional, complementary, alternative, and approaches to medicine. By way of definition, traditional medicine is that complementary medicine whereby alternative medicines encompasses diverse healthcare practices emphasizing holistic and patient-centered care. This definition goes a long way in making it very simple for traditional practitioners to alternative medicine to do the health services to save the lives of the community, the global citizens, and their patients. It is also very, very important that traditional medicine is well understood because they helps in fostering collaboration in the practice and also enriching global healthcare services. It is also vital because with this understanding and fostering collaboration between the patient stakeholders, it will make them to be more globally accepted in rendering global services to healthcare services. Next slide.
Yes, sir.
Is traditional medicine. By way of definition, ancient healing traditions such as Ayurveda, Unani, this Indian word, and the traditional Chinese medicine. That is how they define the traditional medicine. It is an ancient healing practice whereby they use herbal materials such as leaves, roots, barks, even stems of fruits of plants to heal people or to cure them by extraction of the substances, either by suction, by cooking, or fermentation. Then this traditional medicine have its characteristics. Here, it emphasizes on natural remedies and prevention of holistic approach to health and wellness. It often passes down through the generations to generation. Examples of such characteristics are Ayurveda, Indian language, Unani, Middle East, that's South Asian language. Then traditional Chinese medicine. This is what they use as an example. in traditional medicine. Next slide. Complementary medicine. By way of definition, it combines conventional Western medicine with non-mainstream characteristics. Here, we are referring as characters whereby the complementary medicine are known for. That is to say, it integrates conventional and non-conventional approaches, which are focused on prevention and wellness. Oftentimes, they are used in conjunction with conventional medicine to cure people. Examples of such complementary medicine are acupuncture, herbalism, mind-body practice, especially the one that they did in meditation, prayers, and yoga. Next slide, please. Alternative medicine, that is AM. By way of definition, alternative medicine refers as replacing conventional medicine with unconventional approaches which have certain characteristics such as it is used in place of conventional medicine. It focuses on natural remedy and prevention. It may not be evidence-based, but still, it goes a long way in curing. Examples of such things are homeopathy, naturopathy, and chiropathic care practices. Benefits of integrative medicine. Here we have enhanced patient satisfaction, reduced side effects, increased treatment options, and cultural sensitivity. Future directions or way forward to alternative medicine. Here we have increased research and evidence-based practice, improved regulations, and standardization. Another one is it enhances collaboration between conventional and integrated healthcare services or healthcare providers. Also, we have greater cultural sensitivity and awareness. With these benefits, I think it will enhance the progress, the development, and the growth of alternative medicine other than the Western culture, the medicine. Next slide. I want to conclude by saying that traditional, complementary, and alternative medicine offer valuable approaches to healthcare services. It integrates healthcare and prioritizes prevention, natural remedies, and individual treatment. Understanding and embracing these approaches can enrich global healthcare and improvement. Having said this, it is important and very vital and crucial to focus on alternative medicine other than the Western medicine. So thank you very much. Merci beaucoup. Obrigado. Thank you for that attention.
Thank you. I think that was superb the way you spoke about the three different types of medicine that we have seen today. A wonderful, crisp presentation outlining how each one is beneficial. So thank you so much, Dr. Rex, for that little bit. Dr. Zishan?
Okay, I think who is the next presenter?
I think we are done for the day, sir. I am trying to ask.
Nobody read my citation. Nobody read my profile.
Okay, I think I missed it. Just see. I would like to take this opportunity to invite Dr. Hamid if he would choose to um, mm, share something about chiropractic or cupping, because I think those are two types of uh, medicines that we haven't heard about. Dr. Hamid, would you like to share something a little bit?
Yes, I can share something about
Please,
chiropractic and
that would be
cupping.
great.
These are all the alternative therapies that we are practicing.
Yes.
I'm also the practitioner of these therapies. First of all, I learned the cupping therapy and then acupuncture and then chiropractic. And in upcoming years, I'm also training students and also practitioners about acupuncture, cupping, and chiropractic. And I'm also treating various patients with the help of these therapies.
Mhm. So maybe a little bit about what these therapies entail. Thoda sa.
Yeah, why not? Just when we are talking about cupping therapy, and this is basically a traditional therapy that it has been practiced from the last mostly thousands years ago. And this was the Sunnah of Prophet Muhammad peace be upon him. And for the first time, he used this therapy uh, for the treatment of leg. So from that, at the beginning of cupping starts, that how it's developed from traditional practices, and then almost from now, I think maybe teens or 20 years ago, this practice has been developed by US and the modern countries. And then again, researchers found that these therapies are the one of the most effective therapies that we can use for different types of diseases, maybe specifically mostly for pain. So, and then this beginning again starts because researchers found that they have some effect, and cupping again begin. And now I think has been practiced in almost all countries. Firstly, these was practiced in India and Pakistan, uh, and there are Iran and these countries, Islamic countries. But nowadays, it is more practiced in other countries such as USA, Canada, and all other countries. So those countries that were Muslim populated, they have practiced for the first time, and then lastly, now it has been practiced by these countries also. And acupuncture is basically there are some needles that we are putting on patient body with the help of we are regulating and balancing the chi energy. The concepts of chi energy is that they believe that Chinese believe that it is a spiritual energy that is flowing in the body of every person. We said that every person, men and women, some acupuncture is believed that this is also present in the animals also. So then the animal acupuncture was also started, and with the help of acupuncture, we are mostly balancing the nervous system and hormonal system. We are targeting these two systems, and with the help of these needles, when we are regulating chi energy, so the patient become healthy. These are and then these were practiced in China from I think mostly from 50,000 year ago, and then researchers found that from the last 20 years that acupuncture have some effect uh, by regulating the chi energy from different patients by maintaining hormonal balance and nervous stimulation. And then acupuncture starts, and now I think mostly in almost all countries it has been practiced, but in China it is considered the mainstream medicine uh, therapy. So they integrate acupuncture into traditional Chinese medicine and modern healthcare system. In China, 90% they are managing patient with the help of traditional medicine. 90% patient in their hospitals. So China is basically the basic source of acupuncture and traditional Chinese medicine, and they believe that when you are not getting well from medicine, then they suggest that you should go for acupuncture. If you are not treated with the help of acupuncture and medicine, then suggest the moxibustion therapy, and it is another advanced therapy, and I love these all therapies also. And chiropractic is just releasing the pressure from your joints and adjusting joints and muscles. This is also one of the most advanced, specifically, these has been practiced mostly in India and other countries, USA countries such as America, Canada, and others, Japan. These are also practicing this. So these are traditional therapies, and you couldn't believe that chiropractic is most of the patient. Let's suppose we are when we are talking about sciatica. So most of the time, uh, patient using medicine from 10 years, from 20 years, but they can't get relief from these medicine. So they can go for acupuncture or chiropractic. And chiropractic techniques adjust these joints. And we know that most of the joint we have there, most of the joints are the pathways for our nerves and blood supply. So what we are doing, adjusting these muscles and joints can relieve from these pain. So chiropractic is best for joint dislocation and also pain. And acupuncture is mostly helpful in pain and maintaining hormonal balance, such as mostly for female disorders we are using acupuncture. And cupping is another thing. If you want to be stay healthy in your life, so you should go for cupping. It is one of the best also. So it is another advanced field. One day, inshallah, we will talking also about that specifically on acupuncture, on um, cupping therapy, moxibustion, and there are many other therapies also. Thank you so much, Dr. Rani.
Thank you so much, Dr. Hamid. I have two questions for you.
Yes, sir, you can.
Since you spoke about chiropractic and you said that it is to deal with joints. So, people who are suffering from rheumatoid arthritis, would they benefit from chiropractic? Because I think what I have seen or experienced, I have known a couple of cases where, they have been administered, what do you say? What are those things called? The last stage of medicine, that is, I'm forgetting the end stage of medicine. They've been, told to have steroids to help alleviate those conditions. So, would chiropractic help someone suffering from rheumatoid arthritis or arthritis in general? That's my question.
No, no. Basically, that's another thing. Chiropractic help in pain specifically. If you want to remove the pain of the,
Okay.
alleviate the pain of the arthritis, so it will help, but
Okay.
not for prolonged use. We
Okay.
can use chiropractic for just balancing, for adjusting the joints and muscles. If you
Okay.
have a muscular pain, you can go for
Uh,
chiropractic, and
So,
you
so,
also go for acupuncture.
so you mean to say in cases of dislocation, it would be more beneficial to use chiropractic?
Yeah, that would be beneficial.
Okay, okay. And the other question that I had, you had spoken about acupuncture, balancing chi energy. Would it be effective in handling, like we have so many types of addictions that youngsters, I'm worried about the youth currently, because I do work with young, young adults, and they are into different kinds of substance abuse. Would acupuncture help alleviate that? Or it's just again, like you said, for pain and balancing the hormones?
Yeah, that is very much important question that you asked. Acupuncture is very much important in addiction, specifically in youth if they have anxiety, depression, stress, and addiction also. You can suggest for them, and it is one of the best. Scalp acupuncture is another field in acupuncture. It is basically very much important to use for addiction also. And I was there was one patient that I treated from the last 5 years. He was suffering from anxiety. I
Okay.
just 3 times I just do acupuncture on him, and he cured from this anxiety. And he was using from last week. He was using medicine for anxiety. So that not be helpful from an acupuncture. Just in 3 sessions, he will recover.
Yes, I mean, because I do come across young adults, and you can understand there's a lot of substance abuse prevalent in society these days because it's become a fad. So, thank you so much for giving such important information today. Dr. Zishan, would you like to add something?
Yes, yes, I want to ask one or two questions.
Yes.
Thank everyone for the just concluding part of the conference. I want to ask, when is this conference going to hold next year? Is it the first quarter or second quarter of next year? Then secondly, our audience, what are we going to do to increase our audience and more participants to make it more robust and more interactive? Even though this one is interactive as well. So this is just my two questions.
Yes, Dr.
Thank you
Rex.
very much.
Dr. Rex, we will deliberate on those two questions maybe in another call. Definitely, we can plan when we want to have our consecutive conferences on this. And I think, in fact, I'm sorry for answering that question. I think, Dr. Hamid, it was more for you. So why don't you answer that question for sir?
Yes, yes. First of all, we organized the first international conference on traditional and complementary and alternative medicine I collaborate with Mohammed. She was one of the young guests, and we collaborate together and organize this conference. But I asked from her that we should to organize the second international conference. And one idea come in mind that why not we should to be separate from all these things. We should to have a separate branch in IIU. So then I asked from her that we should go for IIU medical council also. So she suggested me that you should contact with Sir P.S. Pandit sir, and he will accept your this request. And I requested sir that we should to go for that, and sir accepted it, and then we uh, opened the separate branch of IIU. So that we are organizing, and it is the second. That's reason we named it the second international conference, and we will until we are alive, we will organize these conferences together, inshallah.
Definitely, Dr. Hamid. I agree with you completely. So, if I may take the honors to draw this conference to an end, I feel it
Yes.
was a really great learning experience for all of us, irrespective of the different fields that we are experts in. I found this conference really engaging in the way that we covered diverse areas of medicine. We had Anita ma'am share how to use, medicinal plants, or what parts of the plant should be soaked and what should be used in boiling. We had great research on cancer. Yesterday, we had a great presentation on, on allopathic treatments, how we could use allopathy in handling certain conditions. Tonight we saw a conversion of allopathic as well as traditional research on fighting cancer. And of course, Dr. Hamid shared his forte of acupuncture, chiropractices, not to forget Dr. Rex sharing his analysis of the three streams of medicine: complementary, alternative, and traditional. Um, I feel that it was a great session where we shared. I mean, it was great to see individuals sharing their research, which is something that people usually don't do. So I really appreciate all the doctors who shared what they researched about. Yesterday we had someone talk about a very diverse field, but yes, an important field of not just human life but animal life as well. That was Dr. Badr Rasool when he shared his research on frogs and how we can look after their health and how we can manage that. Of course, I would also like to take this opportunity to talk about not just these methods of healing, but also the spiritual angle of healing. So, although, yes, we as patients treat doctors as God when we are in problem, whether it is a traditional practitioner or a conventional American practitioner or any other kind of healthcare individual, because I think after God, we feel doctors in whichever field and faith that we have in are the saviors for mankind. I know we add the extra pressure on the field of medicine, be it traditional or the conventional American systems. So I take this opportunity to, first of all, thank Dr. Hamid Rasool and the IIU Medical Council, especially our founder, Advocate Piyush Pandit sir, for thinking of creating such a platform where we could connect, collaborate, share knowledge, and gain knowledge. I feel learning is a collaborative effort where we do share our viewpoints and are ready to accept others as well. So I would like to thank Sir for creating the platform of IIU, Dr. Hamid for conceptualizing a medical council within the IIU, making it more diversified. Heartfelt gratitude to you, and my heartfelt gratitude to both the chief guests for both the days, Dr. Shafia and Dr. Rajput, for gracing the occasion and adding their energies to this conference, as also all the expert doctors that we had on the panel, and some who we did miss sadly. But thank you all to all the doctors for sparing your precious moments and being on this platform to share your knowledge and spread the light of knowledge and learning to the rest of the world. So heartfelt gratitude to all of you. Heartfelt gratitude to all the global audience that we have had on the FB Live. I'm sure you have gained a lot from all the deliberations that were presented yesterday and today. With this, I would like to wish everyone a very good evening and good night, to stay safe, stay healthy, and we hope to interact with you in yet another occasion on the platform of IIU. Thank you so much for being here on the 2 days and helping us become more knowledgeable and learned. A heartfelt gratitude to everyone present today and to all the panelists yesterday. Thank you so much for making it come alive. And thank you, Dr. Hamid, for orchestrating this entire conference. Really indebted to you for thinking of such a thing and making it happen. So congratulations to you, sir, too.
Thank you.
Bye-bye. Good night and take
Thank
care.
you very much. On behalf of IIU Medical Council Nigeria, I say thank you and goodbye to everyone. Congratulations.
Yes. Thank you so much. Bye-bye. Good night and take care. Stay safe. Hasta la vista till we meet again. Bye-bye.